and get started. So good afternoon, everyone. This is Keisha Pollack at Johns Hopkins Bloomberg School of Public Health. Since this is our first meeting of the year, let me take a moment and just wish everyone a Happy New Year. Looking forward to the year ahead, and as I was saying to a colleague this morning, you know, the work we're doing is incredibly important, and I hope that everybody knows that we are here at the Coordinating Center to support the work that everybody's doing to advance physical in this country. Reminder, we have so if you're not online yet and you'd like to be online, please log on. But there will be slides to follow, so I hope you can get on and look at the screen. I also want to remind everyone, when you're not speaking, if you could please mute your phone, that would be great. So we'll begin, as we usually do, these calls with some brief updates before I turn it over to our presenters. And let me just turn it over to Tom to see if, Tom, if you're on the line with updates from the CDC. All right. So we'll come back. Maybe Tom will be joining momentarily. So we'll come back to CDC updates in a moment. I'll turn it over to Amanda in a second. We'll do some coordinating center updates. I will just begin by saying we as a coordinating center are looking forward to the upcoming Active Living Research meeting. Amanda will talk about some times we have to get together. We also are continuing to strengthen the working groups and encouraging and supporting them, and we have some carryover money from last year that we're hoping again to be able to share with the working groups as we did last year. And so I'll be in touch soon as soon as we know what that looks like. Let me turn it over to Amanda to talk about our Coordinating Center and PAPRN Plus at ALR. We have a few opportunities to get together, and we'll have a poster session as well at the poster session. So Amanda, if you can provide the update, that'd be great.
Sure. Hi, everyone. I know that not all of you will be attending the ALR conference, but we're definitely looking forward to seeing those of you that will be there, and just wanted to remind everyone of the events that will be happening at the conference related to PAPRN. And the first of those, as Keisha said, we're going to have a poster at the poster session, and that will be on Sunday evening. And the main focus of that will be on the overall coordinating, or overall PAPRN network, but specifically focused on the working groups and the projects that they've been working on throughout the year. So I plan to develop that poster. I'm going to be sending it around and asking the working group leaders specifically for input, but I encourage everyone who is there to stop by. I know that Keisha and I and Tom plan to be at the poster, but we encourage those of you that are there to stop by and spend some time talking to people as well, especially if you won't have your own poster that evening. So again, that's on Sunday night. On Tuesday morning during breakfast, we'll have a meeting with just the coordinating centers. So I know that's just a few people on the call that have coordinating center funding, or sorry, collaborating center funding, and that will be again on Tuesday morning during breakfast. And then on Tuesday afternoon, immediately after the physical activity breaks, we're going to have a social hour at the hotel. And so you can come straight back, no need to go shower and change or anything. We just thought it'd be nice to have some informal time for folks to get together, and we'll provide some light snacks, and drinks will be kind of on your own at the bar. So again, that's Tuesday after the physical activity breaks. And then on Wednesday morning during breakfast, we will have a working group meeting. And everyone is welcome to come to that. We are certainly encouraging those of you that are already involved in the working groups to participate, but even if you're not already in a working group and are interested in learning a little bit more about what's going on or just listening in, you're welcome to come to that as well. And we'll send out the details. We're finalizing the rooms for those. We're working on just getting a little bit bigger space for the working group meeting so that anyone who wants to participate can come. And so again, we'll send out more details in an email so you have that in your calendars and everything. But we just wanted to remind everyone while we're on the call today.
Amanda, what time is the social hour on Tuesday?
It is at 6 o'clock.
Thanks.
Yep, so the physical activity breaks are from 4:30 to 6, and then we'll just kind of expect people to come back and gather at the bar right after the physical activity breaks.
Great, thanks.
Yeah, we said at that time, Jamie, just people can still hang out for a bit and go to dinner after if they'd like, or so we hope people want to come on by, and as Amanda said, we'll be providing some light fare, some appetizers for that event.
Great, thanks.
Welcome. Much, Amanda, for those updates. And again, we'll remind people of those events in the minutes that we'll send out after this meeting and in our next PAPRN Plus newsletter that goes out. Before I introduce our speakers, let me see if Tom is on to give any updates from the CDC.
Yeah, I'm on. I apologize. I was actually on a YA study, which is part of the PARC study, which is I think of as a sister program to PAPRN, and it was the kickoff to the first intervention strategies. I really don't have much to say. I know people are curious about year 4 funding and where CDC may be going, but we don't really have any more information than you do in the public. I think I can reassure people that internally PAPRN is well thought of and we have support. We have no idea what external sort of forces might change the funding levels for the whole institution or for specific aspects. So we have no more information than you do on that information. The other is, I just wanted to mention that the presentation we're going to hear in a minute, there are actually 2 Robert Wood Johnson funding opportunities, and I think the link went out to both of them, but if not, I'll make sure you guys are aware. One is particularly interesting to PAPRN, and the other is more institutional, but may be of interest. So we'll make sure you get those.
Great. Thank you so much, Tom. Does anybody have any questions on any of the updates? All right. Well, hearing none, let me just jump right in and just briefly introduce our 2 speakers today. We are thrilled that we have Jamie Shariki from the University of Illinois Chicago and Amy Eiler from Washington University in St. Louis to talk with us about new RWJF initiative that they're running. And we're excited to hear about the work that they're doing and talk about that and also allow time for questions. And their presentation is entitled Overview of the Policies for Action, Children's Healthy Weight Hub at the University of Illinois Chicago and Washington University in St. Louis, excuse me. So let me turn it over to Jamie and Amy.
Great, thanks so much, Keisha. This is Jamie, and Amy and I are going to be sharing this presentation. We actually, as Tom alluded to, will be actually talking about one of those RWJ funding opportunities at the end of our presentation, so don't jump off if you want to hear about a funding opportunity. But it's a pleasure to present to you today. We were fortunate enough to have been selected to jointly run a new RWJ Policies for Action research hub focused specifically on children's healthy weight. And so we're going to give you an overview of our work today, very similar to the PARC presentation from our last call, where we're really getting off the ground running right now. So today we're going to tell you a little bit about the Policies for Action program for those of you who don't know about it, and then an overview specifically of our hub and our team and the specific projects we'll be working on. And then Amy will introduce to you as well this new call for proposals that just came out that actually has a targeted set aside specific to the work that we all do in the area of children's healthy weight. So very exciting times. So without further ado, I'm going to do a very quick overview of the Policies for Action program at the Foundation. Many of you may have been familiar historically with the Public Health Law Research Program. That program expired in the last couple months or year, and it was replaced with a different model, which is called the Policies for Action program, and it really is honing around the culture of health theme that the Foundation has. And the goal of the Policies for Action program program is quite broad. It's really to study policy and law to support a culture of health and identifying policy and legal strategies that really can help move the needle, move the dial forward in achieving a culture of health. So the mission of the program is to support research that will yield actionable evidence regarding how policies, laws, and regulatory tools, both public and private, can support the Foundation's mission to build a culture of health, improve population health, well-being, and equity. So it's really studying the impact and of these policies and their implementation. It's not just doing, you may be familiar with public health law research where they funded a body of work that was more just what I would call policy surveillance, just looking at the content of laws. That's not what Policies for Action is about. It's very much akin to the type of research that many of us do, which is studying the implementation impact of specific policies and laws. So Policies for Action is organized such that there's a National Coordinating Center now at the Urban Institute. They coordinate the 5 hubs and independent investigator grantees, such as those you on the call. And they also are going to be responsible for synthesizing and disseminating work across all the projects funded under the Policies for Action program. There's a National Advisory Committee, which includes representatives from each of the hubs, 5 research hubs, as well as some external advisors. And then currently, in the first round of grantees, they funded 6 grantees, and now they are looking to fund another round of grantees in this new call for action. So this slide shares with you information on the 5 research hubs. NYU, Sherry Gilead is focusing on housing, transportation, and a variety of other issues that impact health. Hers is much more somewhat local, but also a little regional work as well. Paula Lance and Peter Jacobson at University of Michigan are focusing on health and all policies, as well as social determinants of health. Lisa Dubé and Levin Aaron at Urban Institute also have a hub. So they're the coordinating center, but then they also have a research hub. They're focusing on the intersection of housing and food sector policies. They're looking at fiscal and income related policies and healthcare policies. So, and then finally, Temple was originally the coordinating center, but now they're a research hub, and they're focusing specifically on housing-related law and legal instruments and how law can be used to create more equitable communities from a housing perspective. Our hub is new, and we were just funded starting on September 1, and it's a collaboration, full collaboration between the University of Illinois at Chicago and Washington University in St. Louis, and Amy and I are co-PIs on the project. What makes our hub quite unique compared to the other 4 hubs is that our hub has a specific topical focus, which is on children's healthy weight. However, as you all know, because of the fact that children's healthy weight is affected both by their energy intake as well as their energy expenditures, our work spans the gamut of food-related policies and diet-related policies as well as physical activity-related policies. So our theme is children's healthy weight, but the policy strategies that we're studying cover both sides of the energy balance equation. So the other hubs are a little broader in terms of covering lots of different issues like housing, transportation, early childhood education. They're focused on social issues and income impacts and things like that. We're focused on the theme of children's healthy weight. And the special set-aside in the new call for funding that Amy will describe in a little bit is a specific set-aside to fund a couple of projects that focus in this area of children's healthy weight. The grantees who were awarded in the last round are shown on the screen, and you can see it's a wide range of grantees and partners. Many of them have co-PIs on their projects, so that's something you might want to explore as Amy talks to you about the funding opportunity going forward. You can see it includes a wide range of topics as well, all focused in the RWJ Culture of Health foci, but it includes some food-related issues and SNAP and things like that. The one thing that Amy will probably talk quite a bit about when she talks about the opportunity is really this theme of equity and early childhood and access and things like that, social determinants of health, more so than topical foci. So let me tell you a little about our hub specifically, and that's why we are here invited here today, I think. The purpose of our hub, as I mentioned, is to study the implementation and or impact specifically of on-the-books laws and public policies that focus on improving children's diet and activity through a series of sub-studies. So early on, we were trying to understand the distinction between our research and our hub and PARC, and Tina Coe is also our program officer, and the real distinction she made for us was that we're really focused on studying the implementation impact of what's already on the books, specific laws and policies, studying how they're implemented, what their ultimate impact is on children and young children's outcomes, as opposed to what we heard from PARC last call, which is focused more on helping to drive policy change and studying interventions and conducting more standard interventions and how they can inform policy going forward. So our studies, rather than being in an individual community or in a region or an individual school district or something like that, our studies are going to typically be nationwide type studies. For those of you familiar with my prior work in Bridging the Gap, it's very much akin to the nationwide type work we did under Bridging the Gap, and Amy's done nationwide work as well. So when I say typically, you'll hear in a minute about our 4 different categories of studies. One group we're not quite sure about yet, but typically our work is going to be nationally focused. So as I briefly mentioned before, we were initially funded in September of 2016. Our current funding will go through August of 2018 with the hopes, if we prove ourselves, of continuing beyond that. We went through quite a bit of an iterative process in the proposal development stage to identify projects with the foundation. So the projects that we are working on were ones that were identified in conjunction with the foundation. Our proposal and all of our project proposals did go through a peer review with external researchers as well. So we received feedback on our approach during the proposal stage before we actually moved on to the actual project work. This slide briefly shares with you our study team, and I believe Sandy is on the call as well. Sandy is a co-I on the University of Illinois at Chicago team, and we have a great team assembled at both institutions, and Amy, as I mentioned, is co-PI on the project from the Brown School of Social Work at Washington University, and she also has a great team and other investigators at WashU who will be involved at various stages throughout the process. So this slide shares with you our 4 categories of projects. I'm going to start with just briefly describe the first one and 4th one on this slide, and then Amy and I will go into more detail on the 2nd and 3rd ones in a minute. So the first study, which is least relevant for this particular audience, although some of you may have split personalities like me and actually focus on food and physical activity, so you might be interested. So the first study is the assessing implementation of the new U.S. Department of Agriculture's Child and Adult Care Food Program meal pattern standards, which are scheduled to take effect in October of this calendar year. Hopefully the regulation will continue to go forward. So we are planning to do a national survey of child daycare centers across the country that are participating in the CACFP program to understand, sort of provide baseline data and understand where they stand relative to their preparation for implementation of the new standards, their familiarity with them, and things like that. And then we'll be selecting a very small sample of survey respondents to do some key informant work with in the summertime to get some qualitative insights on preparation and familiarity and experiences with implementing these types of standards. We'll then do an initial post-test evaluation, a follow-up survey in the spring of 2018, and assuming our project is able to continue past August of 2018, we will plan to do another round of follow-up in the additional grant year. And that one will also include some qualitative work next summer as well. And then briefly on item 4, one of the things that the foundation asked us to do was to set aside some of our project funds to do some of the rapid response type projects to study implementation of specific Voices for Healthy Kid initiatives. They haven't determined what is in our bailiwick versus what's in Parks or Healthy Eating Researchers Program. So we're sort of on hold waiting to find out what we might be doing in that area. What would make our rapid response projects a bit different than Parks and Healthy Eating Researchers is our team would actually do those rapid response projects versus Park and HER, I believe, are providing subfunding for other teams to do that work. So in terms of the 2 studies that we are moving forward with right now, it's the Head Start activity standards and pay-to-play policies. I will briefly describe for you our Head Start project, and Amy will briefly describe pay-to-play, and then she will conclude by telling you about the new funding opportunity from Policies for Action. So for those of you who are not familiar, back in September of 2016, the Administration for Children and Families updated their Head Start program performance standards to include new language specifically related to physical activity as part of their teaching and learning standards. And I included the language on here specifically, but it's basically saying that they must recognize physical activity as an important learning tool, integrate intentional movement and activity into curricular activities and daily routines, and they cannot use physical activity as a reward or punishment, meaning withhold activity as punishment for poor behavior or something like that. Because the rule took effect in November of 2016, and this project was one that we didn't come to agreement on with the foundation until after our grant started, we're going to be doing a post-test only implementation study to learn about specifically, we're going to be studying how are those standards requirements for physical activity as part of center teaching and learning standards being implemented. And we're going to do this in 2 ways. We're going to study the role of state agencies in providing technical assistance, training, guidelines, documents, things like that, to Head Start programs and implementing this provision. For those of you who are not familiar with Head Start, it's a program to support low-income children aged 0 to 5 and their families. And the second part of the study will be studying the perceived underreported costs at the program level associated with the implementation. So briefly, in terms of our methods, for the state agency part, and Sandy Slater is going to be helping to co-lead this study. We're going to do an inventory of state Head Start program material specifically focused on program materials related to guidance, technical assistance, and other materials related to incorporating physical activity time and reducing sedentary time during the day at these Head Start programs. One of Amy's postdocs, Samuel, is also supporting us with a literature review in this area, and that information will help us to develop a key informant survey that we will be doing with state Head Start program officials to really learn about their experiences. Importantly, how are they defining physical activity? Amy and her team have some insight into this, in that many of the programs really have different definitions of PA. So at the outset, we want to understand what do they mean, how do they define PA relative to Head Start, and how might that frame implementation? And then we'll be asking about other types of technical assistance and training and other things like that relative to the programming. We'll also be inquiring about the types of questions that are being asked by programs relative to implementation of this new provision, so we can get a sense of sort of where is the field relative to this. The second part of the study, after we do the state key informant interviews, and we are planning to do key informant interviews with all 50 states, so we plan to have sort of an inventory of state positions relative to Head Start PA programming. We then plan to do possibly a web-based survey of a nationally representative sample of Head Start programs. We're still trying to determine the data collection for the second part. But the goal with the second part, and this was really of interest to the foundation, was to really understand their awareness of the policy change, any changes that they've made to their daily schedule and programming as a result of the policy change, and then if they actually are implementing it, really getting any information we can on perceived and or actual costs in terms of staffing, time, training, toolkits, new equipment, things like that. We plan to do a variety of different dissemination. Like Park, our goal with dissemination is to be as wide as possible and as broad as possible. And so our primary dissemination tools will be through policy briefs and reports, webinars, Head Start provider meetings, and then of course we'll do some academic journals, but that's not our primary dissemination mode. And so as I mentioned, we just got started on the background research in this, and we're planning to develop our instruments and IRB in the next couple months, and then between July and August of next year, really conducting the study. So I'm going to turn it over now to Amy, who will briefly tell you about our Pay to Play project.
Great, thanks, Jamie. So one of the projects, as Jamie mentioned, that we're doing in our hub is exploring this concept of pay-to-play policies. So if you have children, you might be aware of this. If not, I'm sure you've seen this lately. It's been in the news. Many states and school districts are charging for participation in extracurricular activities, including sports. And these policies can be state guided, where the state legislation allows for this, mandates that there must be waivers or exemptions, or there's a couple pieces of legislation out there that are prohibiting this. So the policies vary in amount of fees, type of waivers, and enforcement, just like any other category of policy. Our hypothesis is that the overall effects of these policies are disproportionately affecting low-income students, because many of the policies, even though they say they have waivers, there's really not a good indication that they're actually being implemented. Jamie, could you? Thank you. So our research questions are first looking at the trends at the state level. Jamie's team has helped collect all the policies at the state level related to this topic, and for the last 5 years, and we're doing a content inventory of that just to see if there's any trends and what the landscape looks like at the state level. And then we want to know what is the extent to which pay-to-play policies affect high school sports participation in general, and then to see if we can get the information on the perceived impact of these policies related to low-income students. Because this is a topic that varies by state, it is difficult to say that we'll be able to get information on low-income participation for all states. So we are going to get the information from directors, athletic directors within districts to see if they perceive that there is this outcome. So our methods, first we are doing a state legislative scan and content analysis. All the bills are collected right now, and we're developing a content analysis tool, and we'll look into those bills very soon. We're also doing key informant interviews. One of my research assistants has done a very thorough scan of the popular press and gray literature and has information, sort of what's happening in each of the states. And we chose, our goal is to get a sample of 8 to 12 states, but we have a list of about 15 that we're looking at. And we hope to get at least 10 state-level representatives from the state-level high school sporting association, and then 10 district representatives, and interview them to inform step 3, which is a quantitative survey of school district athletic administrators. And we will do this in each state, and each state will be, the sample will be proportioned to size by the number of districts, and our sample will be about 2,800. Given about a 40% response rate, which is what we anticipate, that will give us enough power to detect our outcomes. So this is sort of our timeline. We're in the middle of the state legislation analysis, doing the key informant interviews, getting the IRB squared away, developing the questionnaire and for the quantitative survey, and then we'll also be looking at district level policies as we do those interviews, and then implement the director survey over the summer, and then analyze the results over the fall. So after those project summaries, a little bit of good news in this crazy week is there was a new call for proposals released by Robert Wood Johnson on I think it was Monday or Tuesday, and so I just wanted to talk a little bit about that because it aligns with a lot of what PAPRN is doing, and I think it provides a good opportunity for research in this area. So the goal is to help understand how policies, laws, and other levels can help build their culture of health. If you know anything about Robert Wood Johnson in the past couple of years, this is the big theme, this culture of health. And they have a framework, and if you want to or are thinking about applying for this, it is so important to look at this framework and their action areas because it really will help inform what projects are likely to get funded. This call for proposal seeks to engage multidisciplinary research teams and experts not only in the areas that are often represented, but those that reach out to well-being and equity such as labor, criminal justice, education, transportation, housing, and other built environment areas. The research funded under this call for proposals can help build the evidence and fill the gaps in our knowledge about how policies relate to this change in health, and particularly related to social determinants of health in improved population health improvement, particularly equity. Equity runs through the whole culture of health and needs to be a big part of these projects. So approximately $2 million will be awarded, and $500,000 of that will be set aside for at least 2 projects related to our Children's Healthy Weight Hub. The grants are up to $250,000 for a maximum of 24 months, and it's related to our policy hub that Jamie explained early. The research should be on the implementation or impact of policies relevant to early childhood school environments to support children's healthy weight and reduce childhood obesity. The policies could focus on the nutrition end, the physical activity end, or other determinants of health that have an important implication related to children's healthy weight. Just some timeline issues. The brief proposals are due March 20th, and after those are assessed, those with an invitation to do a full proposal, the proposals are due early May, or they will be identified by early May, and then the full proposals are due middle of June with a notification warrant in August and grants initiated in October. Here's a link to the call for proposals, and there's the contact, the Urban Institute, and like I said, the Robert Wood Johnson Culture of Health framework is available on their website and provides some really good guidance on their priority areas. Jamie, do you have anything to add?
Yeah, I would just add that I believe they did a webinar on the new call for proposals the other day, so I would look at the Foundation's website and the Policies for Action website, which I'll show you in a moment, because you might be able to see a summary of that webinar up there. And then this is Amy's and my contact information. I think many of you know both of us, so I'm going to skip that and go to the more important one for your purposes for funding. This is the Policies for Action URL, and as Amy said, their email and other important information. So strongly encourage you. The Policies for Action call is very broad, and it can focus on any area in the Policies for Action domain. Amy just highlighted for you the specific set-aside funding that they have this year in this area of children's healthy weight. So with that, Keisha and Amanda and others, we are happy to take any questions.
Great. Thank you so much, Jamie and Amy. Really terrific presentation. I had a couple of questions to ask if you guys would be willing to share your slides. So I don't know if that's the plan, or if so, that would be great. We can put them up with the rest of our documents. But I wanted to just pause and let folks ask questions. Both of your projects sound really terrific and very interesting, and I think important evidence for policy. So feel free to ask questions on either of those projects and or the call for proposals. And again, for people who are mute, please unmute your phones. We can hear you.
Hi, this is Amanda. I did have a question about the pay for play for the high school sports, and I know the folks at NC State have looked at how kind of using intramural sports can increase participation, and wondered if that was something that you'd plan to look at in that study.
We're not focusing on intramural sports necessarily. It's sort of a different category, so we weren't anticipating that. But certainly we're open to exploring it as we're collecting our data.
I mean, I think they're good. It could be a good complement actually to
right.
You know, see the impact of paying to play, and then how intramural sports can potentially help to fill that gap and involve more kids.
Right. Yeah, that's a great idea. One of the things that I forgot to mention is there's really not a whole lot of literature on physical activity in particular related to these policies, but there is not a significant amount, but information on how this affects sports participation, which then affects college scholarships and could really impact particularly low-income kids in that way. So we're trying to fill that gap of the physical activity part.
Great. Yeah, that's exciting.
And Amy, this is Keisha. I also had a question about your project. I was just, I was talking to somebody recently about this program at their school, and I was wondering, are schools themselves, or is this sort of at a district level where people are setting these fees? I mean, I'm wondering if your work is going to sort of tease that out, or come up with recommendations for different levels of decision making around these, or just wondering if you can say a little bit more about that. I'm not sure how that works.
So most often the fees are set at a district level, not at a school level. But what we don't know is how they're being implemented and followed through. And then there's this whole other category of policies that are related to this, such as transportation. If someone stays after school for sports, can they still get home, or do they have to pay additional for that? So there's that whole piece of it too that we need to look at.
Great, thank you.
So Keisha, back to your earlier question, we'd be happy to share our slides. So we'll send them to Marianne and Eric after the call.
Thank you. Thank you very much. I know, I'll ask a question, you guys, in terms of your the funding proposal. I had a couple of colleagues ask me as they're trying to figure out, what's the connection between policies for action and the research for action, and whether or not they, how do they sort of navigate the process of deciding like which ones of those to apply for? I guess it sounds like going to the website to see the specific areas is the best way to go, but just wanted to know if you have any other comments on that for people on the phone who might be wondering the same thing.
Yeah, so I think you're talking about evidence for action, right? As the second one?
Yes.
Okay.
Sorry, yeah.
So, no problem. So, policies for action and evidence for action are sister programs, and evidence for action can also involve studying policies, but that's not its focus necessarily. So, evidence for action can involve environmental change strategies and interventions to provide evidence for policy change going forward. Whereas policies for action is specifically focused on the role of policy and law at supporting a culture of health. So the intervention for policies for action has to be policy and law. So to me, that's the real distinction, but you could still look at some policy interventions under evidence for action, but that's not the focus of it like it is with policies for action.
Great, thank you. That's helpful, so I can better explain it to others, and hopefully other people are clearer who had a question about that.
Yeah, and they both have open calls right now, so I strongly encourage people to explore both of them. I don't know if any of you, RWJ has this invitational Culture of Health meeting in February, so if any of you happen to be going to that, they usually have a session there where the programs present on the call for proposals. But if not, on their websites, I think they have recordings of their webinars describing both sets of proposals.
Great. One of the things,
so I guess,
Jamie,
Keisha, we'll turn it back over. Amy, oh, sorry.
I just had one other question, I guess, for you, Jamie. I was really appreciated your comment when you were presenting about the various products that you guys are presenting, and you said, you know, peer review papers are there, but they're not, that's really not what this is about, and which I think is really a true testament to RWJ guys, and just really wanted to see if you had anything else to say about that. You know, so many times that is where we're focusing our efforts, but that's not where for policy change we really need to be focusing our efforts.
Exactly, and you know, we've been personally shifting in that direction for a while now, Amy's group too, and really figuring out what evidence will most likely be used by decision makers to institute change. And we know it's not academic papers. And so, you know, finding those modes and mechanisms that will speak to decision makers and can be readily used by them to influence change is really the goal here. So, you know, our program is called Policies for Action. So the goal is to lead to actionable change. You know, of course we want to get our peer-reviewed manuscripts out of this, but for sure our priority in terms of dissemination is absolutely on those other products. Some of you may have seen those Complete Streets products that we released recently, and so those were similar. They were, you know, the goal first was to get some more lay-type documents out. We're working, I see Sydney's on the call, and we are working on a qualitative analysis, formal one for a transcript, for manuscript purposes, but that's coming second after the more policy decision-maker oriented products. We also hope that our products will be used not just by policymakers, but by the advocacy community as well. And so I neglected to list that on the slide earlier, but we also plan to sort of, you know, coordinate and communicate with key advocacy organizations so that they can help promote and spread the word about our findings.
And Keisha, you brought up a good point earlier about the pay-to-play, you know, developing some sort of best practices and information to give back to those decision makers on this specific topic, and we totally intend to do that.
Yeah, and I will say that for our first two studies, Keisha, which are both tied to federal regulations, which we hope will still stand, that particularly in this climate, providing feedback on the implementation and or impact of those regulations, particularly if they are being revisited, will be really important. And so the most expeditious way we can do that will be through some of these more informal types of documents rather than academic channels.
Yeah, that's just terrific. And I know some academic institutions are moving towards sort of valuing that more in the promotion process, so I hope to see sort of more faculty moving in that direction as well.
Yeah, one thing that I think that we are planning to do is, and we're actually doing this with a project with CDC right now, we're developing a series of policy briefs with them. We're following the healthy eating research model and sending these more informal products out for peer review and acknowledging our peer reviewers in the final published products. So even if they are more informal, they're still being peer reviewed and treated just as if they were an academic publication.
Yeah, which is great. Great. And I know I've peer reviewed things for ALR before that they put on their page, so I think that's such a really important process.
Yep.
Are there any other questions before we transition to our final point, which we'll just segue into? I just wanted to see if there are any other questions about the call for proposals or either of the projects that Jamie or Amy shared with us today.
And I will just add, if anybody's interested in CACFP, feel free to reach out. It's been a nightmare of a project. It's, if you can believe, there is no national database of child care sites participating in the federal CACFP program. We've actually had to create an entire sample frame from across the country. So if anybody's interested in CACFP, let me know. And hopefully in the future we'll have more information on the Voices projects. So thanks for the opportunity today. We really appreciate it.
Yes, thank you very much.
Yeah, thank you so much, and this was really terrific to hear from you guys and to hear about this great work. And Jamie, I have a thought on CACFP. I'll follow up with you over email. And I just want to thank everybody for just being so engaged in that conversation. And again, I had a few people email me to slides, so thanks for sharing the slides, and we'll make sure that those are up with the recording from this call. I want to just transition to sort of our open mic and see if folks have things that they want to share. This is the time to make any announcements, to share any thoughts. I have one comment that a couple of people emailed me about that I'll share, but just wanted to see if there are any other opportunities or things people want to talk about right now.
Hey, Keisha, I think Tom, I don't know if you're still on, but I think Tom may have something he wants to.
I'm on, but I just wanted to mention the other the other Robert Wood Johnson Award, which is called the Build Health Challenge. It's really oriented towards, I think, hospitals and health systems, but I think enough of the PAPRN people have interactions with those systems in some way or another that it's worth just checking them out as well. They'll be giving out $250,000 in a very variety of categories, 21 total awards. So it's worth also a few minutes looking at their webpage for that.
Great, thank you, Tom, for that. And that website is just at buildhealthchallenge.org, I think.
Yeah.
You guys can look at more information on that. Thank you. I know a couple of people have reached out to me about something I wanted to throw out, just in terms of wondering, you know, in this current political climate, you know, what's the best sort of just wanting to have more guidance and sort of getting evidence to decision makers and the best ways to do that. And clearly there are many people on this call who are experienced doing that. You know, we just heard Jamie and Amy talk about their work, and somebody had asked if we could have a future talk about sort of translating research to policy and you know, whether it's about briefs or op-eds or sort of best ways to communicate, and just wanting to know if individuals are interested in that, if people sort of feel like they're wanting a little bit more guidance on how to get their science into package it and better get it to the hands of individuals who are making decisions about public health programs and other things. So I just wanted to throw that out to see if that's a potential topic folks want to hear about on a future call, or if there are any other topics that individuals are hearing about related to sort of more skills or translational research or dissemination implementation. Happy to pause and take suggestions now for that.
Keisha, it's Jamie. I will vote for that topic. I think it would be great. If you can get Ross Bronson, he might be a great speaker for that. But if not, there are plenty of others out there who could.
Great, thank you, Jamie.
Hi, Keisha. This is Erin Hager. I was listening in with Katie. I want to echo what Jamie said, that I think it's a great idea. And I don't know if you could even get a either a current or former legislator who could maybe comment on what they look at and how they use information that's given to their office to make policy decisions.
Yep.
Something like that.
Yep. Great. Thank you, Erin. These are great ideas. And are there other thoughts?
Keisha, building on Erin's comment, Erin, I really like your comment. I mean, one thing, since the work in PAPRN spans so many different sectors and types of policy, I'm almost wondering if maybe like there could be like a panel, you know, webinar or something where we could have maybe a planner and a transportation person and a legislator, you know, because they'd be very different types of decision makers, and they might rely on different types of evidence.
Yep, great suggestion. It was when I was writing down planner writing down next to legislator, and I like the idea of a planner and transportation and bringing these various sectors who do make decisions differently. Mm-hmm. And I have a couple legislators in mind who I could tap to see if we can get some call on our next call in 2 months. And it might even be too, I work with somebody at the local level and as well as at the state. We could potentially bring in some various perspectives. And that could be a series of these. We could do a few of these over the next few months if people are interested. I think it's always helpful to think about better ways to tailor and package our messages that they're getting into the hands of decision makers in the way that they prefer to receive them.
I think that's a great idea. Amy, I don't think Stephanie or Karen are on the call, but obviously given their grant and their work, they might have some good people they could recommend, and obviously Arlie, the work he's doing as well. So I think across the networking or collaborating centers, we might have some good connections for speakers.
Great. We can certainly put a call out for some suggestions. Awesome. Thank you. And we'll follow up with some folks. All right. Great. Thank you. Are there other comments or questions or anything else for this open mic?
I'll just put a plug for those of you who like going to APHA and plan to attend APHA. The call for abstracts are due February 21st to the 24th. I forget the exact date for the PA section. I don't know if Keisha, you or Amanda know the exact date, but just know it's a little less than a month away for abstract submissions for APHA. So number of slots that each section gets is determined by abstract submissions and membership. So let's try and support the PA section and get as many abstracts in there as we can.
Yeah, thank you so much, Jamie. So the PA section's February 22nd. That's a great reminder for us to put in our announcement that goes out. Certainly submit abstracts. PA is in Atlanta this year, November 4th through 8th. And the theme in the meeting is creating the healthiest nation, climate change is health. Clearly there are implications there for physical activity policy that relate to the theme directly. And so I encourage you to submit your abstracts for that February 22nd deadline. Thank you for that plug, Jamie.
And this is Tom. I'll try to remember, but once we know the number of who from PAPRN might be coming to APHA, maybe we can have a little get-together and either do something at CDC or in town.
Oh, that's a great idea, Tom.
Yeah. Absolutely. And I know, Tom, and I thought about this because I know you had reviewed abstracts, and I think several of us on the phone have reviewed abstracts for America Walks for the Walking Summit. Just as a reminder, that's coming up in September in Minneapolis. So folks are interested, keep an eye out for that great meeting. It's in St. Paul here. It's in St. Paul, September 13th through 15th. So again, we'll have a reminder out in our follow-up from this with these upcoming meetings. So hope people are able to attend. And again, if there's a critical mass of PAPRN plus people there, that could be another opportunity for folks to get together. Great. Any other announcements?
I just want to say hi to Amy if you're still there. Hi, Amy.
Hi, Tom. Nice to hear your voice.
Awesome. Well, thank you, everybody, for making time today. Really appreciate it. And thank you again, Jamie and Amy, for a really terrific presentation. I hope that we can get you back in the future once you finish your research, because I think the projects are really important. CACSP is a critical program, and about these pay-to-play programs, both with important equity issues. So we're really excited for your work, and thanks again for taking the time to share it with us.
Thanks for having us, and we'll definitely would love to come back and share our results.
Awesome.
Thank you.
Great. So have a great day, everyone. I'll talk to you soon.
Bye. Thanks.
Bye.
Bye all.